the American Urologic Association has very good guidelines right now on how to early screen men for prostate cancer. And it's actually a grade A recommendation to use PSA as the primary biomarker. It's not one of these molecular tests, although you can use that to help out in the screening process. So PSA screening should begin around the age of 45 to 50 and can be done every 2 to 4 years, although I believe most urologists and primary care physicians do an annual screening. There is a recommendation, however, to start that screening as young as 40 in men who are high risk. Now, who are those men? Family history and African American men. So if you fit into either of those risk categories, you should probably begin your PSA screening at the age of 40 because you are likely to present with high risk aggressive prostate cancer potentially at a younger age. So you do the PSA screening, and there are some myths and misconceptions about a digital rectal exam. A lot of men don't want it because it's uncomfortable, and although guidelines don't state that it's absolutely imperative to do a digital rectal exam, it can give us a lot of information about the prostate. It's not the most sensitive, for example. You feel the prostate, you're checking for nodules, but it can give us a pretty good guesstimate, if you will, about the size of the prostate. If I have a man who comes to me and he tells me, and this actually happened just a month ago, I had a man come to me, 60-something years old, "Doc, I'm peeing a lot. I have to wake up at night. My stream isn't what it used to be." So I did something very basic. Simple physical exam. You do a digital rectal exam. And to me, it felt like he had a mildly enlarged prostate. But what concerned me is I felt a nodule at the same time. Now, this man had never checked his PSA. It was his first time seeing anyone. His wife made him come and see me. So I went ahead and ordered a PSA. It was elevated. Got a prostate MRI, showed a suspicious lesion, ended up biopsying him, and he actually had grade group 2. So he had clinically significant prostate cancer, and he ended up having surgery and thankfully is doing fine. But the point is that PSA is a great test for screening, but there is a role for digital rectal exam as well. If not so much for prostate cancer screening, although it can pick up suspicious lesions, but it's a really quick physical exam maneuver that you can do to tell the man in front of you, do I think your prostate is big or not? Do I think the prostate's potentially contributing to your symptoms or even potentially contributing to your elevated PSA? So we screen our men starting at age 40 or 45, depending on their risks, and we continue until 69 is the cutoff according to AUA guidelines because, a lot of, physicians got together and it was discussed that screening after the age of 70 produces more harms than benefits. Now, there is controversy surrounding this too, especially with the recent diagnosis of our former president, Joe Biden, with metastatic prostate cancer. And the question is, was he screened? Did they not screen him because he's over the age of 70? The average male life expectancy in the United States is 75 years of age. So as we're living longer and potentially healthier lives, should we be screening our men after the age of 70? And I think this is an important discussion to have with your patients.